Hey guys, welcome to another question of the day. Today's question is about a breast lift. And the patient asked me is how much breast tissue do I need to have in order to have a breast lift? So let's talk about breast lift. It has nothing to do with the quantity of your breast tissue. When I'm evaluating you in the office to determine whether you need a breast lift or not, what I'm looking at is the position of your nipple relative to your breast fold. When we talk about sagging or drooping of the breast, the medical term for that is ptosis. So when I see you in the office and we determine whether you're going to need a lift or not, what I'm looking at is the nipple at or above the crease, which we would call a grade 1 ptosis. And sometimes if a patient's just getting an augmentation, that can be good enough. If we're looking at the nipple and it sits at or below the breast crease, that would be considered grade 2 ptosis. Grade 3 ptosis is when the nipple's on the lowest part of the breast mound, most of the breast tissue is hanging below the crease, and the nipple is basically pointing straight to the floor. There's a fourth type of ptosis that doesn't really have anything to do with the position of the nipple, and it has more to do with the position of the breast tissue relative to your crease. So pseudoptosis is when the breast nipple areolar complex is sitting at or above the fold in a very beautiful position, but you have a quantity of breast tissue that's actually sagging below the fold. And that's usually treated by just taking off a little lower pole skin wedge off the lower pole of the breast in order to get rid of that hanging skin. So when we do your breast mastopexy, what we do is we reposition the nipple into the center of the breast mound. Now, one thing you should know about a mastopexy, which I get asked a lot about, is will I have a nice shape to my breast? You will have a nice shape to your breast, but if you're looking for that nice full round breast where it's round on the top, only an implant can give you that. Sometimes in rare instances, patients have enough quantity of tissue and quality of tissue to be able to create that nice round upper pole, but gravity wins and it usually settles over time. So generally, if you want that upper pole volume, you're gonna need an implant for that. But a breast lift in and of itself can be a wonderful procedure and give you everything that you're looking for. But that's how we determine whether you need a breast lift. It doesn't have anything to do with the quantity of your tissue, it's the position of the nipple. So I hope that helps answer your question. Thank you for asking it. Again, you guys ask the question and I'll answer it. Have a great day.